You would always see what Hollywood shows you about pharma. That is only sales reps and cars and neckties. And they show a very bad image, unfortunately, of what pharma really is. I told my dad, I'm thinking of joining pharma as an MSL. The first sentence he told me, are you telling me after 7-8 years of medical school, you want to go and sell drugs? I'm going to be very provocative here. MSLs are not glorified sales reps. The MSL is not just there to prepare the market for a product based on what a lot of pharma leaders think. It's to prepare the system for better care.
When we say one of the metrics for performance measurement of an MSL is behavior change. Now, looking at it from the medical practitioner's perspective, are we starting with the assumption that there's something wrong with their behavior?
I remember one KOL once told me, can you please tell your MSL not to come and discuss with me a paper that I published? Everybody claims patient-centricity, but what does it actually mean? It actually means that I'm not serving the HCP. I'm serving the patient. And the HCP is my partner in that journey. And this is something that we need to admit and we need to work towards. We can no longer have MSLs who do not know how to use a CRM tool or hate AI. To all the humans listening to this podcast, you will still have a job. Congratulations, okay? You're not gonna be killed, you're not gonna be dead, you're gonna have a job. You can move really fast alone, you can really move fast, but you can only move far if you move together with the others. If I look at the MSL job, the MSL science is his ticket to get into this room with the physician. But staying in that room will require more than science. And why? Because
Dr. Carlos on leadership, purpose, and the future of impact in life sciences. Let's dive in. Carlos, welcome to Drug Diary. Before we jump into today's episode, I just want to say something from the heart. Over 93% of the people who watch this podcast regularly haven't subscribed. And listen, I get it. Life is busy. You click, you watch, you move on. But if you've ever felt like this show brings you value, if it has made you think, sparked a new idea, introduced you to something inspiring, then I have a small favor to ask. Please hit that subscribe button. It might not seem like much, but to me, it means everything. This podcast has always been a labor of love. No sponsors, no script, just honest conversations with people trying to make a difference in the world of healthcare. And your support, your one click, helps me keep doing that. It helps more people discover these voices. It helps this community grow. So if you're here, if you believe in this, please consider subscribing. Thank you for being here. Now let's get into the episode. Picture this. It's 7:45 in the morning in Sao Paulo, or maybe Singapore or Stockholm. An MSL is on their way to meet a cardiologist they've been trying to see for months. They've prepared the data, rehearsed the story, and still they're wondering, will this meeting actually make an impact? Because in today's world of medical affairs, impact is one of those words we throw around all the time, but rarely stop to define. Is it the number of interactions, insights captured, or is it something deeper, something about changing understanding, inspiring trust, bridging science and society? This is the reality of medical affairs today, a world where science, strategy, and human connections all intersect. And what's fascinating is that its influence now stretches far beyond its own function, touching every part of the industry, from clinical development to commercial, market access, policy, and patient engagement. The truth is, the way medical affairs evolves will shape how the entire life sciences ecosystem delivers value in the next decade. And few people understand that world and what it takes to lead in it better than our today's guest. Dr. Carlos is the Executive Director of International Medical Affairs at Novartis and one of the most respected thought leaders, shaping how global medical teams think about purpose, performance, and patient impact. He has built and led teams across continents, mentored future leaders, and consistently challenged the industry to look beyond activity and focus instead on meaning. In today's episode, we're not just talking about medical affairs. We are exploring leadership, influence, and the future of how science meets strategy, and how the most successful leaders in pharma are rethinking what impact really means. So whether you are an MSL on the road, a medical leader navigating change, a commercial strategist, a clinical innovator, or simply someone passionate about how this industry is evolving, this conversation will make you see the role of medical affairs and leadership itself in a whole new light. Dr. Carlos on leadership, purpose, and the future of impact in life sciences. Let's dive in. Carlos, welcome to Drug Diaries.
Hello, Kaushik, and thank you so much for inviting me to be a guest on your show.
It's an absolute pleasure and an honor to have you, Carlos, on the show. Thank you for joining.
Welcome. I mean, you did a great introduction and you brought in a lot of topics and a lot of points. So let's dive into that.
Thank you. So, Carlos, one of the things I find fascinating about people in medical affairs is that almost everyone's path here is accidental, or at least unplanned. It's rarely something we grow up aspiring to do. But for those who find their way here, it becomes a real calling. So I'm curious, what first drew you into medical affairs and what keeps you inspired to stay in this space?
Well, great question. And I would say, so when I finished medical school, I started a residency in anesthesiology and intensive care. And you have the impact that you do on patient lives. It's very visible. You really enjoy it because that's why you sign up to be a doctor at the start. To be honest, I wasn't aware at that point that you can join pharma as a medic, right? To join medical affairs and to have an impact in medical affairs. You would always see what Hollywood shows you about pharma. That is only, sales reps and fancy cars and neckties. And they show a very bad image, unfortunately, of what pharma really is. And they're a bit stuck in maybe 20, 30, 40 years ago, what it was. Then I had a few friends who were working in pharma and they started explaining to me the role of the MSL and the medical advisor and the great work that they could do in terms of research, in terms of education, in terms of partnerships, in terms of really bringing life-saving, innovative medications to patients, really finding solutions to diseases that never had a solution. And what was fascinating for me is the impact such a role can have beyond the four walls of a hospital or even beyond the borders of the country I came from, which is Lebanon. And it's one of the smallest countries in the world. So then I thought to myself, okay, what if I can utilize my passion to make a change in patients' lives, my passion to really bring a change to this world and use that in pharma and have my impact go beyond borders, beyond the walls, and make a huger impact globally, which luckily is where I am now. The funny thing about that was, I'll tell you a quick personal story. So after making that decision, I went home and met my parents. That was 15 years ago. And I told my dad, Dad, finished med school. I'm doing a year of anesthesiology. I'm thinking of joining pharma as an MSL. And I still remember his face to this day. It went all white, black, gray. I cannot describe it. And the first sentence he told me is, are you telling me after 7-8 years of medical school, you want to go and sell drugs? That was a funny way of putting it, right? Like, and it also, jokes aside, it also shows you the perception people have of pharma, that you're selling drugs. And it made even my mission stronger to really bring out to the world what the true value of pharma companies and respectable pharma companies are when they do things right.
That's such a resounding experience, and it resonates with my own experience because I started in the industry as a medical rep, and my father, although he wasn't disappointed, but people would often ask me, does your son has a job or he still works as a medical rep?
That's a good one.
So that's interesting to hear. And Carlos, the old saying, what gets measured gets managed. In medical affairs, that's tricky, right? Some of the most meaningful impacts happen in moments you can't measure. A conversation that changes someone's perspective or a piece of insight that shifts a strategy months later. It's real, but invisible. So I'm curious, how do you think we should be rethinking impact in medical affairs? And how do we capture those intangibles that really matter?
So, Kash, when we're talking about impact of medical affairs, I mean, it's a huge topic. It's the holy grail. Really figuring out how we can measure the impact is really something that every person is trying to answer. But sometimes we go too lazy because when we see that it's going to be a mix of qualitative and quantitative measures, and then we're like, okay, let me just go to activity. Let me just count the activities and this would be better. There are certain things we need to understand when we really want to measure impact. if I look at the MSL job, okay, the MSL science is his ticket to get into this room with the physician. But staying in that room will require more than science. And why? Because the MSL is not just there to prepare the market for a product based on what a lot of pharma leaders think. It's to prepare the system for better care. So yes, we prepare the market for a product, but we need to prepare the system as well for better patient care, because science is only powerful when it moves systems and not only when it moves conversations. So this is why in my framework, I try to look at, yes, activity is very important, but then when I look at the activity and when I have the system change in mind, the outcome change for patients in mind, there needs to be a middle layer. And this is what I called impactful contributions, because medical affairs can have a great impact that you can measure, by the way. And more than happy to have a discussion on the details of how to measure that impact. And I've written on 1 or 2 articles on that on my profile. But you can bucket the impact of medical affairs in 4 distinct areas. One is scientific education, which we do very well. The other one is strategic partnerships. Then you have the evidence generation, making sure you're generating the right evidence for reimbursement, for access, for clinical adoption, to make sure there is diversity, equity, all that you need in terms of data to make the future product successful. And then you have the healthcare system strengthening, making sure the healthcare systems are ready to adopt such innovation and to implement such innovation and take better care. So this system change, which goes beyond just educating KOLs or discussing science with KOLs, which goes around all these 4 pillars, is what is needed first as a mindset before we start measuring the impact. If you have that in mind, measuring the impact, it will become very easy, because then you can do trial and error and really start measuring the right impact.
Wow, that's a fascinating and profound look at impact. And I really like what you said, that science is a ticket to get into the room, but it does not guarantee your success in that room. So
yeah, because if you just stop at activities, what you've achieved is motion, not impact. I mean, let's be honest. Activity is just noise. It means that you're doing something. Now, if you want to measure impact, you need to go beyond activity, and you need to really show what is it that you're changing? What is your why? What is the why behind an activity? I'm going to take a bit of time on that, because historically, or even when I started as an MSL, I was given a list of KOLs. I was given a slide deck, and I was asked to take that slide deck, visit that KOL, deliver certain messages, hoping that the impact would be what is called behavioral change. If I'm going to be very provocative here, MSLs are not glorified sales reps. So if behavioral change means getting more prescriptions, then we're paying a hell lot of money for MSLs, because you can do that with a sales rep. And the sales rep job is to get sales, and they are better trained to get sales, and they are better communicators, maybe in some ways, to get the sales. The MSL's job is not to get sales. There's a different sort of thing. So this is why, going back to your topic on impact and how we measure impact, we need to move away from just activity and delivering messages to what actually is that the MSL can bring to the table. And in that sense, in one of the articles I wrote about the POG, and I'll introduce the POG later, which is the patient-centered, outcome-driven, and growth-focused medical affairs persona. If we look at the outcome-driven, activity is always there as a base, because you cannot have impact without activity. But then you need to start with the why. And I'll give you a very tangible example, because always people say, okay, give me an example, or how do we do that, or show me how this can be done. Let's take an example. Let's take a disease, COPD, okay? I choose a disease we're not working on currently so that they don't say I'm divulging the company secrets. So let's take COPD, and let's say that your ultimate outcome, or the impact that you want to do, is reduce exacerbations in the country where you live. People might challenge and say, I'm not able to measure that. Well, if you don't have claims data, if you don't have real world evidence, if you don't have databases, if you cannot tap into data, which will be definitely the future, I'm going to accept that excuse. I'm going to say, okay, you cannot measure the rate or decline in exacerbations. Let's take a kind of not a surrogate marker, but let's go one step down. What if you can measure patients being discharged on guideline-directed medical therapy, or patients being on guideline therapy? This is also easily done by tapping into data. But let's even think that you cannot measure that, you can at least have a logical approach to what theoretically can change that outcome. In the term of medical affairs, you cannot come and say, I'm going to do visits, deliver messages, and then I would expect the exacerbation to be reduced. You have to have a logical middle step, which I call impactful contributions. Now, others may call it something else, or they might have different frameworks. But the whole concept behind impactful contributions is that these are areas where medical affairs can provide the most value in order to drive behavioral change, and not at an HCP level. And I think this is very important. If people are lost in what I'm saying, just remember one thing, which is the mindset shift from focusing on an HCP to focusing on system change. So the 4 buckets are scientific education, strategic partnerships that go beyond HCPs into societies, patient groups, policymakers, etc. Evidence generation. And then the 4th part is healthcare system strengthening. Sometimes you have the most innovative drug, but the healthcare system is not ready to have that drug in the system or being used or prescribed, or they don't even know how to test for that disease or how to monitor, or etc. etc. Medical affairs can have a great impact in those 4 areas. And then if you make all your activities with a purpose to impact any of those 4 areas, to ultimately impact the outcome, this is how you can start measuring the impact of medical affairs one step at a time.
Sure. And maybe double clicking on that topic and asking a slightly controversial question. When we say one of the metrics for the performance measurement of an MSL is behavior change. Now, looking at it from the medical practitioner's perspective, are we starting with the assumption that there's something wrong with their behavior?
Look, I think yes. The short answer is yes. Now, the level of behavior change required is different. Let's be honest. Is healthcare globally being managed in an optimal way? No. If you look at cardiovascular disease, for example, you still see it as the number 1 cause of death, even though you have a lot of therapies. If you look at clinical inertia across TAs, therapeutic areas, clinical inertia is still very high.
Yes.
Diagnosis is still very low. So this is the clarification we need to do. Behavior change is not changing his behavior to prescribe more. Behavioral change is changing the behavior, more changing the systemic behavior or the systems behavior into identifying patients earlier, treating them earlier, managing them better, so that you lead to better outcomes and less healthcare system cost and less burden of disease on society, on patients, and on their caregivers.
It's a great answer. And I totally agree. I think you're absolutely spot on. And if we talk about the evolution of field medical excellence, I've always felt that MSLs are the unsung heroes of pharma. They're out there building trust, translating complex science into real world meaning. But even now, a lot of companies still judge their success by activity matrix. We touched on this rather than impact. And it feels like we are still trying to define what great looks like in their role. So I would love your take on this. In your view, what truly defines an exceptional MSL today, beyond scientific knowledge and activity counts?
No, that's a pain point, I believe, in terms of how are we deploying MSLs and how are we using MSLs and how are we really tapping into the full potential of MSLs. If I look at some companies, I'm not going to say majority, I'm not going to say if it is my company or other companies, but you still hear that MSLs are being deployed late. So why would you need an MSL if your goal is to do system change or prepare for launch or bring awareness to a disease or to a solution that did not exist before? Why would you want this MSL to be in the field 8 years, 7 years post-launch? What is the value that an MSL can bring when everything is on label, everything is already launched, everything is already there? The work starts before. So that's one thing. The second thing is, I always question what is the value when we say that I want to give slide decks to MSLs and they have to go and educate or have to go and discuss science. I remember one KOL once told me, can you please tell your MSL not to come and discuss with me a paper that I published? If we are focusing on KOLs, I don't think these KOLs need education, right?
Yes,
so the question is, what is your purpose of carrying that slide deck and going from door to door and discussing it? And do you think you will still have a role a couple of years down the line with all the advances of AI and you can get any data that you want into your fingertips? I guess you can argue that years before, doctors maybe did not have time to look into everything that was presented at the Congress or read a publication of 26 6 pages, and the MSL was really providing value by coming in and giving the top points and the summary of, everything that happened in the Congress or the publications that came up or the research that the company is doing. But now ChatGPT can give you that in 5 seconds.
Exactly.
Right? And it's going to get better and better and better. So going to your question of what defines an exceptional MSL today, and then I'm happy to discuss the future. But today, it's all about mindset, purpose, and skills. So I introduced in medical affairs something called the Dr. POG or the POG, which I spoke about, which is the patient-centric, outcome-driven, and growth-focused. If I want to quickly tap into these 3, so the patient-centric is about the mindset. My mindset is that I put the patient at the center. Everybody claims patient-centricity, but what does it actually mean? It actually means that I'm not serving the HCP. I'm serving the patient. And the HCP is my partner in that journey. And this is something that we need to admit and we need to work towards. HCPs are our partners and we need to work together. We bring in the research, the studies, the molecules, and they bring in the clinical practice for better patient outcomes. We cannot keep that mindset of my target is the HCP. I just focus on him, on making an impact with him or to him. It's an impact with him to patients. So that's mindset. And in the mindset, you start with your outcome, you go into your strategy, into your tactics, you select the HCPs that will help you along the way. So it's not the other way around where you start with the HCPs and then you pray to God, you know what you want to do. Yeah. And then when you do the activity and you measure impact, the only thing that people are missing is course correction. We start the year with the strategy and the tactics, we end the year celebrating. But how often do we sit down and say, okay, what didn't work so well and what should I change next year so that I can have a bigger impact on the outcome that I'm working on? Now that we're done with mindset, let's go to purpose. What is my purpose as an MSL? If I ask that question and there's no answer, or the answer is, oh, I want to start as an MSL so I become a medical advisor or a medical director. Guys, I know MSL is a starting or entry-level job, but in some countries, it's a career. I know executive directors who are MSLs. It's like an executive director MSL. And you see that in the US a lot. If anybody tells me that, oh, I want to start as an MSL to jump into a medical advisor, that for me is a killer because you don't know what is the purpose of the MSL. And the purpose is not to just step into pharma to go to bigger roles. The purpose of an MSL is to create impact, to make sure that his activities are getting into impactful contributions that are getting into a patient outcome or patient output. So that's purpose. So what did we do so far? Mindset, purpose. And the third and the most important one is being growth focused. The skills, and you mentioned that at the beginning about the scientific expertise. Scientific expertise is great. I think now there's no denial that, I don't need somebody in pharma who's an expert in fried chicken, okay? You need people who've worked in healthcare or understand healthcare and they understand science, which is great. Now I'm going to share with you the growth focused. I look at 6 key points. One is leadership, and preferably transformational leadership, because in this current healthcare system and in this current, let's say, rapid changes that are happening in regulatory and laws and things like that, you need to have this agility and you need to have this transformational mindset of how do I act fast, how I do things differently, and how do I challenge the status quo, and how do I get out of the comfort zone and really drive change. Then you need to think about the enterprise mindset and the business acumen. We can no longer have MSLs who do not know anything about business and who could just tell you, I'm just here for the science and I don't care about the business. Then they maybe should go to work at an NGO. But in pharma, you need to have the business mindset, but also with a lot of integrity. It doesn't mean that, and this is something people get wrong. If you're business focused, you're a successful businessman. It doesn't mean that this is impacting your integrity. Because at the end of the day, if I want to drive business, I want to drive business making sure the right patients are getting the right drug at the right time and not making sure that the drug is being prescribed off label or in other patients to drive the business. So people should not confound these two. So business acumen, enterprise mindset, the strategic thinking. But then as we are evolving, there's data mastery and digital agility. We can no longer have MSLs who do not know how to use a CRM tool or hate AI or don't know how to really tap into data or understand the data or use big data. That will be non-existent in the future. These skills are going to become a must. And last but not least, I would say, and I will end on that note, effective communication. And the reason I say effective effective is because communication is all about connection, is all about impact, and effectively communicating internally, cross-functionally, externally is what will really differentiate the good MSL from the par or subpar MSL. And I think this would be also very key to the future, because with all the digital and stuff and things that are happening, human communication and empathy are going to be the key differentiators for what success looks like.
I really love the clarity of thoughts and the simplicity and the structure that you brought to this conversation, where you outlined the attributes with single-minded focus was very enlightening. And I tend to agree with everything you said. And talking about AI, Carlos, these days we've got AI that can summarize every paper on PubMed, but it still can't replace the trust you build when you sit across from someone and have a real conversation. And it's funny that the more tech we use, the more human connection seems to matter. What's your perspective on that balance? And how do you see the relationship between human insight and digital intelligence evolving in medical affairs and field engagement?
So AI is an enabler, and I'm not going to repeat the cheesy saying of I will not replace humans, but humans using AI will replace humans that do not. Yeah, we've heard that a lot. So I see you smiling. I'm sure you've heard it a million times. Look, AI is an enabler. AI will not be able to do the system change that I was talking about. Connecting the dots between the patient journey, what the HCP feels and wants, what the patient feels and wants, what the business feels and wants. It's going to take, I think, ages. There was a lot of hype around AI, but still until now, we still see hallucination. We still see things that you do not agree with. You still ask for a summary, but you look at the summary and you think like, that's not something that is usable. You feel also the fakeness of AI. I look into LinkedIn and they're all the same posts. Like whenever you see that long dash and whenever you see the rocket, now you can tell. And this is truly showing that you start not disrespecting the content, but you start feeling that it's a bit fake and there's no human touch. So to all the humans listening to this podcast, you will still have a job. Congratulations. Okay. You're not going to be killed. You're not going to be dead. You're going to have a job. And guess why? Because the jobs that are being replaced, which are just like, for example, counting numbers or, writing short summaries of a publication. Okay. These jobs might be amplified with AI, or we might start looking at medical writers who are knowledgeable of using AI because this will help them in their work versus somebody who's has zero digital literacy. So there will be jobs that will be impacted, but if you have this digital literacy, then you're kind of safe. But if I want to focus a bit on AI as an enabler, it really helps in a lot of things. It helps me with my calendar. It helps me with summarizing meetings after we're done and creating the key action points. So instead of doing everything from scratch, I just have to review it and see if there are any hallucinations or anything that it sounds wrong. And then I just send it through. It's helping me summarizing things or summarizing text or doing a quick research. Like there's a nice function in Gemini that does a deep research. It gives you the references. It gives you everything. So you give it a topic. It always gives you this nice initial start to do things. And it also sometimes ignites our curiosity in terms of creating images and our creativity. Sorry, not curiosity, but our creativity also in creating images and creating new visuals, having new perspectives on things. So there is a huge benefit for AI. So that's on the personal side. On the medical affairs side, I can go for hours. From clinical research, where it could help you identify the right target population, the right countries, the right centers that were performing best based on past history. It could help you in summarizing insights that MSLs are putting into the CRM, generating some sort of suggested actions or next best step or all of that. It can help you identify who are the top KOLs in a certain field, the sentiment analysis. It can help in a million ways. My advice, if again, people want to take only one statement or one takeaway message from me, is don't drown in the hype. Make sure that leverage AI to solve a problem that you have. Don't create problems and bring in AI. Look at your day-to-day work. Try to map out some key problems where AI can help you and then invest in that. Don't just go into the hype like, oh, everybody's using AI. I need to bring AI. And then you bring AI and you look at it and then, okay, what do I do now? So that would be my advice.
Great piece of advice. Yes, thank you for sharing that. And talking about leadership across cultures, I've spoken to so many leaders who say that the hardest part of leading today isn't strategy, it's people, especially when your team spread across 5 time zones, 10 cultures, and dozen personalities. I imagine you've seen the good, the bad, and the beautiful of that. So what have you learned about building trust and cohesion across global and multicultural teams?
So that's a really good question. And it always comes in, when we're trying to expand our team. Sometimes we ask, have you worked across continents? And sometimes people say like, oh, but I've had a great impact in Europe, or I've had a great impact in the UK, or why do I need to have this experience? I can tell you the best experience of my life was learning how to work across cultures. I'm a very people-oriented person. I really value the relationships, the interactions, because leadership isn't about control. It's about connection, right? It's about the connections that you build, the respect, and the impact you can do in terms of communication, in terms of the shared vision, the shared purpose across the globe. Now, when you look at across the cultures, my advice is to be authentic to who you really are, because they can feel it if you're faking it. If you're faking your personality just to blend in, people are not stupid. So be authentic, but at the same time, adapt your communication. Don't adapt your personality. Don't change your personality. Just adapt your communication. Adapt the way you speak, you listen, and you need to understand the differences across culture. And sometimes I learned it the hard way, but eventually, for example, if I ask you a question, you might take it as offensive. A different culture might take it as provocative. A different culture might take it as constructive, or, like I'm motivating you to think differently. Sometimes you are on calls and people do not speak. You might think that this is like they're not engaged, but it could be just culture. And I can give you a clear example about that. For example, Japan. In Japan, there's a very clear hierarchy that still exists. And sometimes when they are on a call, you would ask a question, they would mute themselves, have a quick discussion, and then come back. Or sometimes they do not answer, or sometimes they wait for their leader or manager who's in the room to give all the answers. So these are all culture nuances that you need to learn, and you cannot understand it or disrespect it. And then what you do is you just adapt your communication style when you're working across the different geographies, and just learn how to respect the differences. And then you will earn the trust of the people by being authentic, by communicating clearly, and by being respectful.
Such a good piece of advice. And the cultural sensitivities are so critical to business operations. And if you don't understand the layers of different cultures, then I think it becomes really hard to connect with authenticity with teams that are spread across different geographies. And Carlos, I've always believed that great leaders don't just build strategies, they build people. And I know mentorship is something you've spoken about before. So I would love to hear how you think about it. What's your philosophy on mentoring and developing talent? And how do you help people discover their own leadership identity?
So mentoring is a key component that I highly appreciate and I highly respect for different reasons. First, me as an individual, I owe my success and where I am today to the great mentors that had an impact on my career and my great managers over the past 15 years in my company. And I always believe that as an individual, I always like to pay it forward. So the same way I had this mentorship that helped me reach where I am today, how I was 10, 15 years ago as a leader, let's say, is absolutely different than where I am now. And we can talk about that. But when it comes to mentorship, it's not about lecturing. And I observe some people who like to do mentorship and coaching, and it's basically just lecturing the person on what he needs to do and how things need to happen. That's lecturing, okay? I don't know if there's a word lectureship.
Yes.
But it's not mentorship. My philosophy in mentorship is I ask 3 questions. Who is the person, the human in front of me? And I have to acknowledge they are in a very high vulnerable state. It's not easy to go and say, mentor me. If somebody is reporting to me, it's part of the job. But I'm thinking of people, externally or that do not report to you, and they reach out to you as a leader and they tell you, I would love for you to be my mentor or for us to have a discussion. You need to understand that there's a bit of a vulnerable phase here, that this person is coming to you. He's going to be open. He's going to be sharing things, and he trusts you, and you need to respect that. And you need to show the proper respect and the proper support. So 1, who is the human? 2, why is he or she here? Why are you asking for a mentorship? What is it that you need? And this takes me to the third question. What is the value that I can bring as a mentor to your journey, to your path? So by focusing on these three things, it really helps me understand their purpose, their identity, and their destination. And by understanding these things, I can really show value by listening, active listening, of course, intentional listening, whatever we want to call it, and trying to allow them to guide themselves in finding the answer or share some of my experiences or some of similar things. But for me, it's more about not showing them directly the map, but giving them kind of a mirror so that they find the answers themselves. So that's how I would say is my philosophy in mentorship.
More of a Socratic style, I believe. And going back to the point that we briefly touched upon, you said your leadership has evolved significantly in the last 10 to 15 years. How has it evolved? How do you see things differently now?
So, like when I started my career, I was a young rebel, okay? So I was full of fire, impatient for change. I was focused on, execution, building a reputation, but I never realized the impact my pace had on the others. And I started learning as I grew up in the ranks and I started traveling and started working cross-culturally and cross-functionally, that leadership is not just about driving transformation or driving execution or performance, but it's about how you bring people along. It's about how people believe in what you're doing and they're going along with you. They can keep up with your pace, with your vision. And because you can move really fast alone as an individual, let's say contributor, or as a person who wants to work solo in his own silo, you can really move fast, but you can only move far if you move together with the others. So I would say openly, I learned it the hard way. I've had multiple conversations with my manager. I've had coaches because I'm too results oriented and driven. Doesn't mean I quit being results driven and goal oriented, but now I adapt it in a way that you still get to the target, you still get to the results that you need, but you bring along people with you. And this is the change between, let's say, operational focused leadership to what I call now more a transformational leadership / servant leadership, because not only bringing people with you, but also empowering your own team to drive the results and not you yourself as a leader to be micromanaging and following every step of the way, but trusting your people that they have sufficient guidance, they understand your vision, they understand what needs to be done, and empowering them to go there. And if anything wrong happens, we sit down and we learn. And if everything goes well, we celebrate and we have fun. So that's the way I evolve.
Right. And your transformed role as a leader, how do you deal with non-performance now?
So I deal with it in a very critical way. And by critical way, I mean I try to understand the reasons behind underperforms. Sometimes leaders tend to react very quickly. Like something wrong happens, they directly go into a game of blame, of they're not performing well. I've always known that. My way of doing things is to be very critical and very logical. For example, this thing happened this way. Okay, why did it happen this way? I speak to that individual. What do you think are the factors that led to this outcome? I try to understand his point of view. And then I could ask people who've worked together or the cross-functional team and try to get their input as well, their viewpoint. What could have been done better? What could we have done differently? What learnings did we have? And if that person who did that thing has sufficient self-awareness and understands what went wrong and understands what could be done differently, that for me is amazing. And that should come with no, let's say, consequence. And of course, here we're talking about underperformance in some tasks, but not like breaching a code in terms of integrity or in terms of compliance or in terms of ethics. Okay. So we're talking here about, let's say, a project, right?
Yeah.
So for me, the most important thing as a leader is to help the people grow, to help learn from mistakes. If I'm going to be here and claim that I've never done a mistake in my life, I mean, I'm a hypocrite, right? We've all done mistakes, and all leaders say that the only way they grew and the only way they learned is by doing mistakes. So we cannot be hypocrites as leaders and punish people for doing mistakes. Instead, we should make sure that they are learning from the mistake and that we really analyze it and sit together and take some key actions and key learnings so that one, we try to avoid it, and two, it helps develop the future us by having learned properly from what we've done.
Carlos, whenever I meet someone who's achieved as much as you have, I can't help but wonder about the person behind the professional, the mindset, the values, the things that anchor you when the pressure is high. So when you strip away all the roles and responsibilities, who is Carlosi at his core, and what values guide your decision-making in life?
So Carlos say that at the core, as I mentioned, I'm a Lebanese. I'm a Lebanese citizen. I'm an MD, and I'm married. I have two beautiful girls, 5 and 8, and currently I live in Dubai. And on the personal side, I'm a huge Lego fan, so I collect and I build. That's only a small piece of the collection. So I have more than 145 sets scattered across the house. I hope one day I won't get kicked out of the house and be replaced by a Lego version of myself. And I love music. What I mean by loving music is I used to sing, I used to mix music at home, not in a professional capacity, but used to DJ and used to mix music. I used to compose music. I used to play the keyboard, and still now music has a great impact on me. So I hear all sorts of music depending on the mood, depending on the situation, depending on what I need in terms of uplifting or calming me down or whatever. So you can see me listening to classical music from Beethoven and Mozart to heavy metal and hard rock and trance and techno and electronic music. So I have this huge, maybe because I'm a Gemini, I don't know, but everything is possible. So I'm a dog lover who owns a cat, just because I travel a lot and I don't have time for the dog, unfortunately. But I also love cats. And on the professional, or also a bit the soul, if you want, side, I'm someone who really finds joy in helping others. So whether it was friends, family, whether it was people at work, whether it's community in general, like patients, or I used to be a Boy Scout for 14 years. So I've lived my life on service, on helping others, on building good relationships with society and with people. So that's who I am. Now, in terms of I think you asked me about the values. Yeah. So in terms of the principles or the values that guide me or guide my decisions every day, I want to start with integrity. So integrity for me is a non-negotiable thing. Okay. And then after I go from integrity, I would say humanity, being empathetic, understanding the people, not being too quick in judgments. I would say humility, which we keep on learning every day. I'm not saying I'm the perfect person in terms of all the values and the behaviors. We're all on a continuous learning journey, but the humility of admitting sometimes that you're wrong and knowing that you do not have all the answers, knowing that you're not the perfect person in the room when you have certain meetings. And maybe the last thing I would say is pragmatism and drive. So I'm happy to be, I pride myself with being pragmatic. And I think this is much needed in the business, because it's very easy to go into dreams and to go into big, bold ideas that end up in a drawer. But what is even more impactful for me is bringing ideas to life and being very realistic on what can or cannot be done and driving the change. I think this creates more impact versus a great idea that, as I said, stays on a shelf or sits in a drawer. So these are the things I could think of now.
What a rounded, multifaceted personality. And no wonder you continue to inspire thousands of people around your sphere and people who work with you in the industry. I'm really inspired.
Thank you.
And Carlos, there's a new generation coming into medical affairs now. Incredibly bright, digital first, hungry for purpose. But the space can be overwhelming at first. And I'm sure you've seen that shift over the years. For young professionals watching this space, what advice would you give them to build a meaningful, lasting career in medical affairs?
So my advice to the next generation of medical affairs leaders is be clear on your purpose, why you want to join, what is the change that you want to bring, what is the work that needs to be done, the mindset, the proper mindset in terms of conducting such a role, putting the patient at the center of what you're doing. And also the growth focused, as I said before, or the skills, is making sure you have the right skills to take on the job. So don't be, let's say, demotivated if you're not interviewed after your first application or your second application. keep working on yourselves and have that resilience in order to reach what you want. And if I have a message, I can tell you that your time will come. Just don't be impatient. Make sure that you're ready along the way. Make sure that you are the captains of your own ship and not waiting for somebody to drive it for you. Unfortunately, I sometimes get a lot of emails or messages like, here's my CV and if you can find me a job. No, I'm sorry. First of all, this is not my job.
Yeah.
And second, why do you want a job? You haven't shared your purpose. You haven't shared with me anything. I don't know you. So don't think that if you just throw your CV around, you're going to get a job. So try to learn from that. And never stop working on yourselves. Learn more, be curious, ask questions, participate in certain forums, learn more about the industry. All of these will help you in going to the first step and securing an interview or securing a role. And don't be shy to ask for a mentor or for a coach or to try and really take a rotation or an assignment until you secure a full-time job. So these would be my advices to the next generation.
That's such a wonderful piece of advice that is going to stay with me for a very long time. And I'm sure it's going to inspire a lot of people, young professionals who are watching this space and watching this episode. So Carlos, every time I wrap an episode, I love asking this question. It's simple but powerful. If you had to leave one lesson, one thought, one truth from your career and life that people could carry with them, what would that be?
One thing that kept me going and growing, and a thought or an advice that I would give is ask yourself, what is your purpose? Look in the mirror, look at yourself and say, why am I on this earth? What is my purpose? What is the legacy that I want to leave behind? And what is the one thing that I want my family, my kids, my friends to remember me by? This is very strong. And once you really know your purpose and your goal and what you want to achieve in your life, this fuels passion and the determination for you to grow and to really achieve very high heights.
It's fantastic. And that brings us to the end of our today's episode, Carlos. Thank you so much for being here and for sharing not just your professional insights, but your reflections, your honesty, your philosophy on leadership and life. You've given us a lot to think about, from reimagining what excellence in field medical truly means to redefining impact in ways that numbers can't always capture. But perhaps more importantly, you've shown us that real success in the industry and life comes from staying curious, staying human, and staying purpose-driven. And to everyone listening, I hope today's episode has left you with not just new ideas, but new questions to ask yourself about how you lead, how you show up, and how you define impact. Alas, it's been a real privilege having you on Drug Diaries. Thank you so much for your time, your generosity, and your wisdom. Until next time, I'm Kaushik Trivedi, and this has been Drug Diaries. Thank you, Carlos.
Thank you, Kaushik. It's been a real pleasure.